If I've had COVID, do I need a vaccine or am I immune now? So if you've had COVID disease, you do actually have to come forward and have a COVID vaccine. And that's because we really want to be able to boost your immunity. You will have some antibodies, most likely, from the COVID disease, but you should still come forward and have your 2 doses of COVID vaccine to really boost your immunity and have a strong immune response. What's herd immunity? Herd immunity is the level of protection that we have in the community against COVID from vaccination, where the virus cannot spread easily. So at the moment, it's estimated that the level of protection that we'll need in the community is probably around 80% coverage. But of course, that does depend on which vaccines are being used, what variants are circulating, and a whole lot of other things. But essentially, if we have really high vaccine coverage in the community, if somebody becomes unwell with COVID, they can't easily pass it on to others and it can't spread within the community, and that's when we have really strong herd immunity. If I'm not considered vulnerable and at risk, why should I get the vaccine? So that's a really excellent question. We know that people who are at highest risk of COVID have been prioritised to get the vaccine first. But now, as we're trying to really get higher coverage in the community, everyone's going to have to come forward and have the vaccine. And so that includes young people who really don't themselves necessarily feel as at risk or vulnerable to COVID. But in fact, we also know that many young people who had mild COVID disease went on to get symptoms of long COVID or chronic symptoms from COVID disease. So even though you might not feel vulnerable and at risk, you actually are at risk of COVID disease. So it's really important that everyone comes forward and has the vaccine so that we can find a way out of this pandemic. All right, what is long COVID? Long COVID is really those chronic, longer-term symptoms after COVID disease, which we know is pretty common after severe disease. So people being admitted to intensive care units, 3/4 to even 90% of those people are still experiencing symptoms 6 months or more after having COVID disease. But actually, long COVID also occurs in people who have mild COVID disease. And then 3 to 6 months down the track, people are still experiencing symptoms a bit like chronic fatigue syndrome, headache, muscle aches, some neurological symptoms, and really quite debilitating fogginess, poor concentration. And this is something that, a lot of research is happening at the moment, and we're really trying to understand it better, but it's quite debilitating for a lot of people. Thanks everyone for your questions. I hope I've been able to cover some of the ones that you were thinking about today, but please stay tuned for more.